How much Dominican history do you know? Want to learn some fun facts? We have a great and fun way to test your knowledge and learn more about our history. Get your copy of Dominic Anu, Dominica in Puzzle. Fun for the whole family. Available now on Amazon.com. Visit pushpast10.com to learn more. Email us at dominicainpuzzle@gmail.com or call 877-698-9894.
You're on.
Good evening, fellow Dominicans and others of you who are with us. Let me thank you for listening. Today, we are faced with a growing healthcare crisis that needs immediate attention by this government and the people of Dominica. When it comes to healthcare, it should never be viewed as strictly a political issue or impacting only one group in society. You will all agree with me that any one of us at any time may be in need of quality healthcare. Please don't think for 1 minute that this commentary on our looming healthcare crisis is for the purpose of scoring cheap political points, as some of you may have indicated. Far from it. My address to you is born out of my deep personal interest and desire in ensuring the very best for the people of our beautiful country. Further, I draw from the moral strength of thousands of my fellow Dominicans, including those who voted for this current government, in the hope that their quality of life would be improved and who, like me, simply wish and pray for the very best for this country. Most of you would have seen or heard in the recent days about a memo from Dr. Blanc, the hospital medical director, pointing to the fact that, quote, due to significantly diminished supplies of pethidine as well as spinal needles, the elective surgical list will have to be temporarily suspended effective Monday, January 15, 2024, end of quote. This suspension of elective surgeries is just the latest in an ongoing and increasingly alarming list of ailments plaguing our healthcare system. Problems range from demoralized staff to political meddling in the affairs of the hospital, including in the hiring of its board, to the lack of basic supplies, failure to retain professional staff, and an overcrowded mental facility, as well as an overall compromised healthcare system. In some cases, foreign medical personnel are given preference and privileges over our own doctors. Local doctors, based on the political leanings, have in the past been denied access to using the premier hospital to conduct surgeries and other operations. Indeed, most of us would have known or may have heard of at least one person who went to the hospital expecting to return, but who never did. This spate of untimely deaths, which have seemingly spared no one, including newborn babies and young people, is an ongoing problem that is made worse by the unavailability of basic access to drugs, including painkillers and other much needed medical supplies. A closer look at our healthcare system will indicate one that is largely ignored by this government. A look at the country's budget, for example, over the last few years, will show very little emphasis being placed on healthcare. For example, in the 2014-15 budget, only 49.2 million EC dollars was devoted to recurrent spending on health. That is just about 11% of the recurrent spending. 8 years later, there has been very little change at just 11.9%. Fellow Dominicans, a way must be found to divert resources from wasteful spending, such as on a too big and bloated government and cabinet, hundreds of thousands in personal expenses on a monthly basis on one person, the Prime Minister, and useless overseas trips, amongst others. You too must look at the hundreds of millions of dollars from the sale of our passports and indicate or request that this money be redirected to stave off this looming disaster in our healthcare system. It is well known that when senior government members fall ill, they are promptly flown overseas for treatment. Let us not also forget that the Prime Minister himself boasted publicly that, quote, if his children fall ill, he can fly them out. It may be for this and other reasons best known to this government why our healthcare system is so completely ignored and in such a mess. But what about the thousands of Dominicans who struggle on a daily basis to make ends meet and who are unable to travel overseas and who cannot afford costly medication? Citizens routinely shy away from seeking medical treatment, even for preventative purposes, fearful of not being in a position to meet that cost. Health centers across the island are in need of repair and the stocking of medical supplies. In the village of Granford, for example, a health center built in 1986 has been torn down and after 2 years yet to be replaced. Windows are missing at the one in Riviera Syriac for many months now. And across the country, health facilities are in similar or in a constant state of disrepair. A new hospital in the village of Marigot is without basic supplies, and the list goes on and on. It is important that we be reminded that according to the World Health Organization, quote, health is a fundamental human right that is enshrined in international human rights instruments and the WHO Constitution. Every human being, and that includes every single Dominican, has the right to the highest attainable standard of physical and mental health. This is a right, not a privilege. Therefore, when a government neglects the healthcare of its citizens through a lack of funding, quality of personnel, and other such issues, it creates an avoidable humanitarian crisis in its own country. We all know the wise saying that, quote, your health is your wealth. And the state of our current healthcare system is further contributing to the abject poverty of our fellow Dominicans. Without a good and functioning healthcare system, the very future development of our country is at stake. No health means no ability to be productive or to engage in the creation of wealth now or in the future. A poor healthcare system says that those who are responsible are destroying the dignity of the human person. Without health, we're simply unable to flourish physically, mentally, or spiritually. While it is true that currently, I, as the leader of the largest opposition party in Dominica, and neither me nor the party that I lead, the UWP, is in a position to make immediate changes, I wish to assure the Dominican public that when we're entrusted with governing this country, the healthcare and well-being of our citizens will be among our highest priorities. In the meantime, we should take the liberty to make some suggestions to this government that would indicate some concrete steps that can be taken to immediately avert this looming health crisis and to return the country to normal. Number one, that the government appoint a special committee to review the current state of healthcare on the island and to make recommendations to address, among others, medical supply issues and sourcing, the use of medical facilities, affordability, and access to the health system, as well as other ways to better and improve on what currently exists. Number two, the government to immediately strengthen, source, and avail the hospital system of the much needed drugs and supplies that it deserves and it needs at this time. Number three, immediately fire the hospital board and replace the political appointees with true professionals who understand the health sector and who can contribute in a meaningful and unbiased way to its improvement. Number 4, reach out and systematically engage the scores of Dominican medical personnel living outside of Dominica who have shown interest in contributing to the improvement of the country's health system. And number 5, reduce wasteful spending and redirect those resources towards the health system. Fellow Dominicans, at the end of the day, the health of a nation should never be compromised. A healthy and well-cared-for population is critical and essential in any country's onward development. Now more than ever, urgent action is required in order to repair and restore our national health system. And the government of Dominica must act, and it must act now to stave off this problem. All right, so that was a prepared statement that I thought I would read to you. And now, having read this prepared statement, I'm going to basically determine if there is any questions or other things that are coming to me from you. I know those of you that are online have the ability to actually send questions or comments. But I really wanted to do this because I feel deep down that this government has not done enough. It has not done enough to really put an end to what we have in Dominica. It has not done enough to really, improve the lives of so many people. And when you hear about what is going on, when you hear about these issues that we've been talking about, the issue of lack of surgery's been canceled, and you hear the confusion that is being raised even by not the Prime Minister, but by the Minister of Health, confusing elective surgeries and what exactly elective surgeries. The fact of the matter is, if tomorrow you are down for tonsils, that could be an emergency. Tonsils could prevent you from breathing, for example. Tonsils could prevent you from, it can actually lead to your death. So to say that if you have tonsillitis, this is not an emergency is completely wrong. So I'm just saying this to say that we really need to do more in this country to safeguard our health system. And importantly as well, when you think about the fact that there are thousands and thousands of Dominicans living in the diaspora who want to return home, who wishes to return home, but who are scared, who are afraid to do so because they fear that they will not get the quality of healthcare that they need, especially as they approach middle age and beyond and retirement age. So I think it is in our best interest in Dominica to fix our healthcare system, to make it competitive, to make it be such that Dominicans who want to return to Dominica will feel comfortable in doing so. Imagine the possibility of hundreds, if not thousands, of returning Dominicans who can contribute their experience, their expertise, who can contribute so much to Dominica. So we need to do this. We need to act on this. And the time to do this is now. The time to do this is now. And really, we cannot afford to put this off. And like I said, it's about setting your priorities. It's about the government determining what is the best course of action and looking at all of the wasteful spending. I listed some of this wasteful spending, like, this bloated cabinet. If you cut back on the size of the cabinet, you can have some more money to put towards the health sector. If you cut back upon the wasteful overseas trip that does not really benefit the country, but just is really a trip for the boys and so on, if you can cut back on that to only essential travel, you save hundreds of thousands, even millions of dollars over a few years that can be plowed back into the health system. So there are lots of ways. The personal expenses of the Prime Minister, if he would just go back to being a normal person with normal expenses instead of $64,000 a month, all of these are areas where the government of Dominica can save so that it can put on the health sector. But this can only happen if it makes this a priority. In the absence of making this a priority, then we'll go nowhere. So I think that's important. I spent a better part of today talking to many health professionals, both in Dominica and outside of Dominica, because I wanted to get a better sense as to what can be done and how we can do it. So when I speak, it's a reflection of countless hours of conversations with people who know about the health system. I'm not a health expert, but I can draw on the expertise and the experience of many health experts, which I have done. And I'm very grateful to the many persons who contributed, to the many persons who gave ideas, and we were able to discuss this very important issue, because that is a critical issue for the country. If our people do not have quality health care, if every time they go to the hospital they fear not returning, if our people cannot be healthy, they cannot plan, they cannot work, they cannot contribute to society. So there is a direct link between a quality healthcare system and the quality of life that we can live in our country and the way in which we contribute towards its development. So I would really urge the government to view this as a crisis, and as a crisis that needs immediate and urgent attention. We cannot wait to fix the system. It is broken. It is broken, but it can be fixed. It can be fixed. There was a time in Dominica when we had quality health care. There was a time in Dominica when our hospital systems were working. And you think of all of the great doctors we've had, the Dr. McIntyres, the Dr. Grells, the Dr. Sorrendos, and all of these great Dominican doctors who've contributed over many, many years. Dr. Carissa Eten, who did so much work in the primary health care system to alleviate, to uplift, and to build our health system. And today, the health system is broken. Yes, we have a new hospital, the China Friendship Hospital, and I give thanks to the Chinese government for helping us with a new facility. But it's not good enough to just have a new facility. This facility is useless if you do not have the drugs, the painkillers, the medication, like the Demotrol that we've been talking about, and the one that's missing now. If you don't have gauze and swabs and basic things that are needed, so that when the patient comes in, they have the comfort to be able to heal. And so a lot of work remains to be done. A lot of work has to be done. And we as Dominicans need to continue to demand that this is done, that this happens, okay? We can no longer stand by and see the wanton destruction of Dominica's health system. Now is the time for action. Now is the time for the government of Dominica to do what is right by the people of Dominica and take decisive action to ensure that the health system in Dominica is safeguarded and to ensure that the health system in Dominica will survive and will be better for all the people of Dominica. I want to thank you for listening. Thank you for your involvement. Thank you for your many comments that you've already posted on Facebook. We'll get a chance to interact a little later. But I want to thank all the news outlets that are carrying this at this time. And to all the people of Dominica, I want to encourage you to continue to demand what is right by you. And one of the things that you can demand, no matter what your political persuasion is to demand that this government builds up a healthcare system that is rivaled nowhere else, a healthcare system that all of Dominica, including its prime minister, will be proud to be able to participate in. Thank you, fellow Dominicans, and I wish you a wonderful evening and a wonderful afternoon wherever you are. God bless you.
Thomson, did you want to take some questions?
How much Dominican history do you know? Want to learn some fun facts? We have a great and fun way to test your knowledge and learn more about our history. Get your copy of Dominic Anu, Dominica in Puzzle. Fun for the whole family. Available now on Amazon.com. Visit pushpast10.com to learn more. Email us at dominicainpuzzle@gmail.com or call 877-698-9894.
No questions? Well, I'm going to put it up on this.
All right, we're back. I'm told that there's some persons who wanted to interact a little bit. So we certainly can do that. I'm happy to take, all right, we've been told that there is no audio. All right.
Yeah, there should be audio. Can you hear me?
Yes.
Yeah, so I'm just posting the questions so you can go ahead and respond to them.
Okay.
It should be on your screen right now.
All right. So the question is fire who? Yeah. No. What I was one of my recommendations is that the board, the hospital board, because there has been a lot of political interference in the naming of that board. So what I'm calling for is that the current board and its current construct should be gotten rid of, and instead you put a board of professionals, a board that understands the healthcare system. So, for example, if you're going to appoint a lawyer to the board, that lawyer should be somebody who has done medical law, who understands medical law. If you're going to have the head of this board is somebody who, preferably someone in the medical field who understands the mechanics, because the board is critical in directing the activities of the hospital. And we have a board that has been so heavily invested politically, and that is creating a problem. So my appeal is for a board that is completely and totally committed to healthcare, and the staffing of this board is critical. That's how it's done in other countries. You don't have political appointees necessarily being involved in these types of board because it's a highly technical work in terms of sourcing supplies, in terms of the supply chain, in terms of moving around your resources, hiring of doctors, all of this work that has to be done. All right, you need professionals in those positions. So that is exactly what I was referring to when I said that you basically have to do this. So the other question coming, are they saying there's no supplies at all or not enough, that they use what they have sparingly? Part of the problem is, for example, this particular issue of the painkiller, of the opioid that has been used for the operations. Part of what caused that problem is that and that's where the board becomes so critical. A decision was taken some time ago. I've been reliably informed. A decision was taken some time ago to ensure that all of the doctors in private practice source this particular opioid, this particular drug, only from the hospital. So in other words, the pharmacists, like Jolly's Pharmacy and the other pharmacies, they were banned from importing this particular drug into Dominica. So it means that whatever supplies the hospital system got, they have to be sharing those supplies with the private doctors, because that's a commonly used drug in operations, whether it is deep operations or I'm told. It is used commonly in Dominica. So the problem then becomes this particular drug that has to be shared amongst the private doctors, but coming only through the hospital system. So when the hospital system failed to project properly, when it failed to see down the line what was needed, then that's the reason why it ran out. If, on the other hand, the policy was to allow the private doctors to import these drugs, or even to allow the pharmacy to import it, then it means that when there is a shortage within the government system, that they could simply go down, run down to town and buy.
Thomson, we lost your audio. I'm not sure if you can hear me, Thomson, but we lost your audio. We can't hear you. Guys, stay with us. We'll be right back. Dr. Thompson is on his way back into the room, so just stay with us. There we go. Let's try that again, Dr. Fountain.
All right. Yeah,
Yes.
great. So I think I'm back. I'm sorry about the audio issue. I think we've been able to resolve this.
Yes, we're back.
Yeah. So that is excellent. Yeah. So I was making the point that this is a crisis, and someone is saying that we need to listen to the experts and professionals in the health field, and that must be a priority. And that's the other thing that I find. I mean, you know, really, it does not matter to me who the Minister of Health is. I think what is important is that this Minister of Health makes use of the experts, okay? And they're the ones that should be, if you like, calling the shots. They're the ones that should be advising the minister on the direction that should be taken, and it should not be the other way around. All right, and we have to learn in Dominica how to utilize our resources. We have good people within the health system. We have good people. Okay, and we have to learn to make use of these individuals so that we can improve on what we have. And that is what it's all about. You know, it's not about being egoistic. It's not about, you know, throwing yourself out there, but it's about committing to ensuring that we have a better health system. All right. All right, somebody is just saying that we in Dominica, we need to wake up, and we really have to, because you see, the fact of the matter is, right, this health issue impacts every one of us, you know. It might not be you personally, but it may be your cousin, it may be your aunt, it may be your parents, it may be your child. Somewhere along the line, one of us will be impacted, one of us will have to go to the hospital. And so it's something that impacts everybody. And that's the reason why every single person must be concerned about what is going on now in Dominica. And when you have this seeming discord that we saw, for example, with the statement that was made by the Minister of Health following this memo that was issued. I mean, the memo was issued immediately. It made sense that the health administrator informed the doctors that they no longer had access to surgeries, that they could inform their patients who were scheduled to do surgeries today that they could no longer come in. So in my mind, the right thing was done, and it's a question of how it is that you reach to such a critical level, and yet you don't know that you are at that critical level. I mean, something is wrong, and there must be some reworking of the way things are done in Dominica to ensure that this does not happen again. All right, this one is what are we going to do to get these guys out of there? One of the things that we can be sure of is that this government does not have what it takes. I mean, it has taken some people 23 years to realize that, others a lot sooner. But it is very clear that this government simply does not have what it takes to control the economy, to bring livelihoods. It does not have what it takes, absolutely not, to develop this country, and certainly does not have what it takes to cure this healthcare system, because it inherited a healthcare system that was fairly good. That's an important thing to note. You know, the government of Dominica inherited a healthcare system that was in fairly good shape 23 years ago. But what has happened? After 23 years, our health situation is far worse today than it was 23 years ago. So that says a lot. It tells me that this government is not able, either unwilling or unable, to do any of this. All right. So this individual is saying that thank you for addressing the healthcare crisis and other issues facing the country. It is clear that this incompetent regime is incapable of solving the problems that's a national concern for the health of the nation. The only solution is demanding the resignation of this corrupt regime effective immediately. All right. So that's another of the, and in fact, there are growing calls. I see quite a number of persons on the Facebook actually calling for the resignation of the entire government, not only the hospital board. I think that's how serious the issue is. Yeah, so we have persons, you know, basically calling for this. There is also a question coming in from someone else on Facebook and asking, is there mandatory and continued education for the professionals? Again, that is something that's all part of the health system. In talking to one of the health experts today, what he was indicating to me is that you are supposed to have on an ongoing basis continuing training. So, for example, all the medical practitioners, they're supposed to be licensed every year. They have to do their mandatory courses that they have to do, mandatory training that they have to take on a yearly basis to ensure that they're up to date, to ensure that their skills are not sharpened, you know, because of the changing nature of medicine, that they're up on the different drugs and so on. So that is mandatory. I am not sure if that is the case in Dominica. That is something that I will have to find out, whether that is also the case in Dominica, where you have this continuing and mandatory training for professional staff. All right, and that is certainly something that we should look at. Yeah. All right, we're getting some more questions again, calling for the resignation. All right, so we've already answered this question. There were some other questions like I noticed earlier. Let me see if I can set. All right, I'm trying to get to some more of your questions. Let me just read this. It says, at this juncture, we've gone past the point of making recommendations to inepte individuals who demonstrate that they are unable or not prepared to even implement any of these ideas or suggestions proposed. And that, in a way, is the conflict that we have, right? In the sense that you know that they're not going to take on those recommendations. And I was speaking to a health practitioner today who insisted that it is useless. He basically said the same thing. He says it's useless even trying to make suggestions to this government because they simply are not able to do it. And I think that is probably the case, because when you have certain clear things that needs to be done, okay. For example, I talked about the overcrowding of the mental health facilities. What has been done to alleviate the suffering there? What has been done? So long you have the issue of basic medical supplies, and that has not been addressed. I mean, months and months and months, people have been calling the radio station, people have been complaining about just this issue, and it is yet to be addressed. So this individual was of the view, as is one of our writers there on Facebook, indicating that this government is not able to do it. They simply cannot do it. And so it really begs the question, what are we, going to do about it as Dominicans? Because we cannot compromise on our healthcare. We simply cannot compromise on this healthcare situation. It has to be addressed, and it has to be addressed now. Okay, there is absolutely no question about it. All right, this individual indicates that this government has no intention of vacating the office. They should be forced to resign. Again, another call for the resignation of the government. And I think there is that growing sense of frustration in Dominica that this government has outlived its usefulness, so to speak. It has lost no sense of ideas. It's not able to generate new thinking. It's not able to tackle problems and fix them. It's not able to see a problem and put the resources that are necessary to deal with that problem. And that's what you need. You need a certain sense of being proactive. You don't wait for the problems to happen. So, for example, in that instance that we're talking about, why is it that they had to wait until the day before to realize that they were out of that particular drug? What about the management of this? What about seeing down the line that it was going to run out? The question is, are our appointed doctors at home able to find a solution, or do they need assistance from our experts of Ireland? That's a good question, but I'll tell you what, I think that, as I said, we have very competent and great doctors in Dominica, and I want to commend them. I want to commend the nurses who work under all sorts of brutal conditions and who give their best. I've talked in the past about, driving in Dominica at night and having to give nurses, a ride. They're out there in the middle of nowhere waiting for a ride to get to work. These are the kind of conditions that our nurses have to work, and our doctors obviously are facing conditions of imagine having to work in a hospital where you don't have access to the latest drugs. You don't have access to basic painkillers. These are the issues that are facing our health professionals in Dominica. Yet they continue day in, day out to give up the best, to work in the best interests of the country. And we must, in all of this discussion, in all of this debate, we must commend the health professionals in Dominica for giving it the best shot, for giving all that they have. And at the same time, we must applaud the health professionals in the diaspora who have indicated a willingness to join hands. We know that there are a number of professionals who have reached out in the past. They have made suggestions on protocols. They have made suggestions on different techniques. Different things have been going on. But there is sometimes a reluctance to embrace those professionals from outside. I think that it's about time. And that's the reason why I deliberately wanted to recommend that we allow the experts, the health experts, our skilled doctors and practitioners who are our sons and daughters living overseas, that they're able to contribute towards the health system in Dominica. We can only be the better for it. Because as I said, a better health system means that we can be able to do a lot more in this country. Now, the question is, how can this be acceptable after the minister's wage hike? All right, so I guess the question is, the ministers are getting a wage increase while basic supplies are running out at the hospital. And that's the point I was making earlier. It's a question of prioritization. Could the $4,000, $3,000 increase given to the ministers, could that have been delayed so that we could get the necessary supplies into the hospital? What about the billions of dollars from our sale of passports? How about getting some of that money back into the health system? You see, so it's about how you prioritize, how you set your priorities. It is okay to do everything else, but at the end of the day, without health, you can't work. Without health, you just cannot, it's not possible. And we need a better health system in Dominica. The health system is broken and it needs to be fixed. And it needs to be fixed now. All right, and that I think is the concern. A lot of persons, on the chat, voicing concerns about the fact that the government is ministers are taking wage increases or salary increases while we have all of those issues still at the hospital in Dominica. And these are real concerns. These are real concerns. And the question is, how do you set your priorities? And it is clear from everything I have seen, from looking at the numbers in the budget, from looking at the way the monies are apportioned in the budget, it is clear to me, at least as a layman, just looking at the numbers, that health is not a priority for this government. And that sadly is the truth, and that has to change. All right, so another comment coming in, the problem is not the medical, nursing, or auxiliary staff. It is clearly the mismanagement and misdirection of monetary funds. Exactly the point I was making, and that is correct. Like I said, you have tremendous professionals in the field in Dominica working under very difficult conditions. So the problem is not the skill or the training of the practitioners in Dominica. The problem really is the fact that this government has not made health a priority, and as such, you're not putting the necessary resources into the health services. And that is where the problem is, and that is what needs to be addressed. Reprioritization, getting resources in, and really building this health system. It has been done before, and it can be done again, but we certainly need to do this. We certainly need to do this. And I'm sensing a lot of frustration, looking quickly at some of the comments coming in, persons indicating that they that after this big increase or pay wage taken, they still cannot deliver on nothing. So what is that now? Who does that? All right. So the question is, why do you take a salary increase at the end of the day? Nothing appears to be working, and that is a very good question. You know, the other issue again is that is really a part of the problem that we're discussing is the inability to retain trained people. Our nurses leaving very quickly, and part of the problem is because of the tremendous burden under which they have to function and operate. And so at every opportunity they get, they're leaving. So you have to look at how do you retain trained staff? How do you retain? And one way you retain trained staff is to ensure that they have a good compensation package, to ensure that they have a good benefits package, and to ensure they have a good retirement package. Right? That's how you retain quality staff. So all of that needs to be present. That's the reason why I believe that having a committee, what we call a blue ribbon panel of distinguished health professionals who can look very seriously at the health issue. And that's it. That's the commitment I made to the government, to the people of Dominica, that when as a party we assume office, that will be the first order of business. And panel a blue panel, a panel of experts who can take a complete and total look, who can tear this health system inside out, look at it, and make recommendations to improve. And that is what is required at this point. And that's what I would strongly suggest. If it is not done by this government, it will be done when we assume the reins of office in Dominica, which we expect to do in the next elections. All right. Another person here on Facebook is indicating that everything is broken in Dominica, period. Crime has doubled on the Blackmore watch, yet he remains as the minister. Every day I'm looking at several funerals on Imo. The mortality rate has tripled. These guys have no idea how to run a full coup. All right. Certainly a lot of concern there about, again, it goes back to what we've been talking about, the inability of this government to actually, work and get results. And that is what we are concerned about. That is what we're talking about. And some of the frustration that I'm seeing there is really that case. And this other person is saying that there are many patriots on the outside who are willing to contribute to the cause, but the initiative should come from the inside. And I fully agree. I believe that there are many Dominicans, those are some I've spoken to privately, who would love to contribute in a meaningful manner towards the healthcare system in Dominica. But the initiative has to come from the government. It's a government-run system. The initiative has to come from the government. And while I will not go into rehashing the issues we've had, the problem that was faced by Dr. Pascal, by Dr. Ricky, by Dr. Sam Christian, and other really, tremendously qualified professionals who were denied access in Dominica. I mean, it is mind-boggling when you think about it. So, yeah, I agree. It has to be the case that this government of Dominica take the people of Dominica seriously. Take our sons and daughters who are giving service elsewhere, who would want to contribute to the island, that these ideas must contend, these individuals must be given a chance to contribute. All right. Now, this other person is talking about, and I guess a discussion that is a very lively one that continues, is the whole question of, demonstrations and hitting the streets. And this individual says that sentiments of hitting the streets has been echoed across the country many moons ago. And Dominicans are afraid of taking a stance on the one-man state. All right. So that is someone expressing some concern that there's a lot of fear and trepidation as far as taking action on the streets to force some kind of action on the part of the government. All right, and that is certainly the case. So yeah, so it is as I said before, it is deeply concerning that that we're in that situation. It is deeply concerning that how we call it, our health system is where it is today. And I know people, I mean, I've spoken to many persons who are literally afraid to go to the hospital. They have more fear of being in the hospital than of taking care of themselves at home. And that's a very serious situation. I can't remember our country ever been in that situation before. But when you reach to that stage where your citizens feel that they have a better chance of surviving if they stay home and away from a medical facility, then you have a serious problem. All right, you have a serious problem, and that cannot continue. That should not be allowed to continue. And the government of Dominica need to take action. That's the reason why we are doing this Facebook live feed. That's the reason why we are reaching out to Dominicans. Let's not make this a political issue, because it really is not. It's about a human rights issue, as I said. Access to basic mental, medical, and physical health is paramount. It is a human right, and every single human being has a right to. And so we're not talking about something extraordinary or out of this world. We're talking about something that there's an expectation that as a government, you would provide for your people. And so the call continues for the government of Dominica to do what is right by the people of Dominica. You know, I think so much emphasis has been placed on individuals and not enough on the people of Dominica. And really, the people of Dominica have taken a serious hit, if you like. I mean, and I think of the thousands of Dominicans who have voted for this Dominica Labour Party government. And as I said before, when people vote for the government, they're voting with the hope that this government will be able to provide, in a way, provide for them, improve their quality of life, improve their way of life, you know, make things happen in the country. That is why I believe people vote for a government. But they've been disappointed by this one. I don't believe on any metric that this government has done enough for the people of Dominica. After 23 years of being continuously in government, what really do you have to show for it? And that to me is deeply concerning. And I think that the people who vote and people who you know, basically go to the polls every 5 years, that's what they need to reflect on. You know, is my vote really counting? Is the government taking me seriously? You know, and that is what matters at the end of the day. You know, at the end of the day, you want to know that you vote for a government that you can go back and say, yes, we have quality health, we have quality education, we have the jobs that we need, things are moving. But none of this has worked for us in Dominica. And so I think it's more than high time that the people of Dominica demand a change. It's more than high time that the people of Dominica demand better. Okay, that's what this is all about. It's about demanding better. It's about, you know, really asking for more to be done, okay? Because this government is there. They just took a massive wage increase to themselves, while, by the way, ignoring over 2,000 public servants who got zero increase. All right, so that's a government that knows how to take care of itself. How about the people of this country? And that's why we're doing this tonight. That's why we're there lamenting and making suggestions, making recommendations, discussing this. Because at the end of the day, it impacts everyone. It impacts every single Dominican. It impacts every single person in Dominica. And so we need to make this. And this other person is saying that elections have consequences, period. Yeah. And that's the reason why. So when we, for example, our good friend in the diaspora think that going to vote in Dominica is just another trip, you know, a quick trip to Dominica, a day trip to Dominica and back in the US or St. Martin or thereafter, the same day or the day after, there are the real consequences to your actions. And these are some of the consequences. A broken healthcare system, a system where elective surgeries are put to a halt. And again, I was talking to a health professional today. I want to get as much information about this as possible. And he was indicating that elective surgeries could also be life-threatening. You know, you could have elective surgeries that are life-threatening. So the fact that you do not have those basic painkillers, and as you don't have the backup even, so another painkiller that you can use, a general anesthetic that you can use to kill pain and so on if you have to have an operation, is very serious. This is a very serious place to reach. I mean, that is a position of crisis, you know, that is a position of crisis. And so it is highly relevant that we are discussing this. It is deeply concerning to me as, again, as the leader of the Labour's Party, one of the largest party in opposition in Dominica. So we represent a significant number of Dominican people, and I think I speak for all of them when I say that we need to fix that healthcare system, that we need to do better by the people of Dominica. And so that's my appeal for you tonight. I want to thank all of you we've just reached 1 hour, so I think you've heard me enough. But I really want to thank all of you for making the time out of your busy schedule to listen, to discuss, to share your thoughts, to share your comments. But importantly, I want to thank you for helping us put forward the message that, one, the healthcare system in Dominica is broken. It is, or it has reached a crisis situation. And secondly, for insisting that the government of Dominica does something about the health system in Dominica. We cannot continue to experience these chronic shortages. We cannot continue to put off surgeries. We can't continue to not have the basic medicine. We can't continue to have people having to leave the hospital and go into town to get medication and come back to the hospital. That cannot continue. That really should not be something that is in today's Dominica. And so let us continue to raise our voices. Let us never relent in speaking truth to this government and truth to power. And let us continue to fight for the people of Dominica, because after all, we are all in this together. As I said, there are many of you overseas who I'm sure one day would like to go back to Dominica, probably retire in Dominica or spend the latter part of your years in Dominica. So you have a stake in this, you know, that relates to you. It's important to you. And so let us work to ensure that we have a health system that we can all be proud of, a health system that will not hesitate a moment when we think of having to go back to Dominica to live. From me to you, my name is Thomson Fontaine, thanking all of you for being with us on this session of Facebook Live. Special thanks to Simone of Push Past 10 Media for facilitating all of this. Special thanks to Sheridan Gregoire of Q95 for the live broadcast of this as well. And to all of you who participated, let me thank you for your comments, for your very thoughtful comments and suggestions and questions. To all of you, God's blessings, and we'll continue to talk. What I really would like to do is to do this on probably a weekly basis, every week. You know, probably discuss another matter of national importance, but there are many issues that must concern us. So we'll try to make this a weekly feature where we discuss matters of interest. We're not about bashing individuals. It's not about bashing people. It's not about name calling, but it's about a focus on the issues that impact us and how we can do better as a people. That's my focus. That's what I'm interested in. And that is what I'll continue to reach out to you with. And I want your support in that regard. All right. No more. I mean, nothing of the name calling and so on. Let us just discuss as mature individuals the state of the country. And in the weeks and months ahead, we'll have a lot more to say to you. Reveal our plans, reveal what we're thinking in terms of what we can do in Dominica. And when you think of the beauty of this country, you know, when you think of how serenely beautiful Dominica is, and the kind of potential that exists within Dominica. You really want to get things moving. It's like you really want to hold this government if you could and shake them and say, man, come on, do something. Let us move beyond where we are. Let us get to that place where our people have a real chance at life, that they can create wealth, they can make money. Our young people can be encouraged to do great things. Let us get to that place. There is that impatience, I must confess, that I have as a politician in Dominica to really get to that place, because I see Dominica at that point. I see Dominica at a point where the young people are energized, the young people are getting things done. Wealth is being created, money is being rolled around and so on. And people are living good and fruitful lives in Dominica. And that day is coming, So let's not despair. Let's not give up. Let's not lose hope. Above all, let's believe and trust that better days are ahead for Dominica. But those better days can only be realized if we become involved, if we take an active part in our own destiny, in our own futures. Thanks to all of you. God bless you. And we'll link up next week. Say at the same time, we'll link up. All right. God bless you. Bye-bye.